Okay, so let's welcome Jim. Jim is all yours.
Yeah. Okay. Hi everyone. Good afternoon, everyone. Yeah, my name is Jim. Yeah, when I 1 month ago when I started doing this topic colon cancer, it happened that I came across there's a news. There's one celebrity also died of colon cancer, and I'm not sure whether you watched the movie. It's a Black Panther. So the lead actor who died of colon cancer at the age of 43. And back then he got colon cancer at the age of 39. So I guess this colon cancer is no longer used to be for those older people. Back to this colon cancer, and then today our sharing on this topic is to see, I also see that whether Ganoderma, how can Ganoderma help in the colon cancer, in particular this disease. Next. Before we start, we have disclaimer. Okay, all the information contained in the slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for a professional medical advice, treatment, or care. Next. First, we look at the overall cancer statistic for colon. Before we start, understand colon cancer. Colon is part of the digestive system, and this digestive system comprises 10 organs. It's just an automated factory. Okay, they process everything automatically. So when we have food in the mouth, when we start to chew, uh, the saliva gland will release the saliva and moist it and make it smaller. And at this stage, the food we call bolus. So this bolus will actually enter esophagus. So this esophagus is a muscular tube that connecting, okay, to the stomach. So this bolus will enter this esophagus to the stomach. So when you reach the stomach, stomach will release the digestive juice to actually crunch the food to be in a creamy form. So at this point of time, they are trying to turn it to creamy and liquid form called chyme. So when the food, during this process of churning the food, actually they send out a signal. Stomach actually send out a signal to liver, gallbladder, and pancreas to get ready for the next process, so that they can actually produce the digestive juice to process. So when the chyme is ready to enter the small intestine, okay, the liver, gallbladder, pancreas get ready all the digestive juice. They will enter into the small intestine. So at this time, the process takes place. They will actually break down the chyme into protein, from protein to amino acid, fats to fatty acid, and carbo to a simple sugar, glucose. So it's a long process. So it's a 6 meter long. So all this will be absorbed by the bloodstream, blood vessel around the small intestine, so that it actually will transport to the rest of the body needs. So 6 meter, give you a sense of how long is 6 meter. In our apartment, from the floor to the ceiling, the height is about 2.6 meter. So you can actually imagine how long it is. So the next process is that everything being absorbed in the almost all the nutrients and vitamin B absorbed in the small intestine, they will actually enter into the large intestine. So large intestine is about 1.5 meter long. So large intestine, the job is to actually reabsorb all the water from this undigested food, okay? And because there's some good bacteria inside, they also reabsorb some of the balanced nutrients and vitamins, okay? So by the time you reach rectum, it's become solid, okay? It's get ready to push up from our body. So the whole process takes place, okay, when from the food until the small intestine get digested, it probably take about 6 to 8 hours, okay? From the small intestine to out of clear the waste from the rectum, it take about 1 to 2 days, okay? That's why when you have constipation, well, Oh, sorry. That's why when you have food stay in the large intestine for too long, you will actually have very hard stool because of all the water being reabsorbed by the large intestine, and it's very difficult to clear if we don't clear within that period of time. That's why every day we need to actually go toilet to clear it out. Next. So we look at colon anatomy. The picture show here the small intestine is just a portion of it. It's a small one, but actually they are 6 meters long. Okay, so only show a snapshot of it. So the next connecting after the small intestine, the food, the undigested food will actually travel to the colon, which is a cecum. The first place they go to is a cecum. Then they actually go up, ascending colon, traverse, and then come down to descending colon. And when you reach the sigmoid area, sigmoid colon is just like a storeroom. It actually accumulate and wait until it get full. They will get ready to push up to the rectum and pass out from the anus. Yeah, next. Okay, colon is part of the digestive system, and digestive system, as shown just now, that it actually function as to process the food we eat and actually extract all the nutrient and vitamin, okay, that our body absorb, and to fuel our body, to provide energy, to provide cell repair capability, and to provide us with all the essential nutrients and vitamin, yeah, so that we can survive. Intestine include small and large intestine. Small intestine is smaller in diameter but longer, 6 meters long, to absorb nutrients and vitamin. And large intestine is bigger diameter but shorter, 1.5 meter. So the purpose is to prepare the undigested food and as a waste object to pass out. So colon is also known as large intestine. Next. Overview of the colon cancer. Colon cancer is just a cancerous tumor in the large intestine. It actually started with polyps in the colon. From tissue, from the lining tissue to polyps, it probably take about 10 years. But take note, not all polyps are cancerous. So some polyps to cancerous, it probably take about 2 to 10 years. So next is a colon polyps is the projection of growth of tissue from the inner lining of the colon. Small non-cancerous benign clump of cell. It's just a small benign. Benign means that it's actually a small lump of tumor, but it grows, but it's not cancerous. So actually, I want to talk about benign and malignant. Benign and malignant, the difference is that they actually, benign will actually also grow, but they won't spread. Malignant is that they grow, but they will spread to other area. So when started off, there's no symptom, and it grows slowly as a silent tumor. As I mentioned before, not all tumors are cancerous. Okay, it depends on whether it's benign or malignant. So some of polyps can become cancerous. Then there are two common types, non-neoplastic and neoplastic. Non-neoplastic, not much of concern because it's non-cancerous. Neoplastic is the one that pre-cancerous type. Next. So symptom. I remember Mr. Sim used to say that listen to our body. Sometimes body will give you a call when there's not when there's something wrong. So probably we have to look at the symptom as a call from the body. So the first thing is to look at the change in bowel habit. So if you have persistent diarrhea, constipation, these are the things to look up. And another thing is that change in consistency of your stool. The other one is a bleeding or blood in your stool. So these two is a bit difficult. I guess most of people who actually do not look at the stool at all. So probably you may want to spend some time to look at the stool after doing the business. You may experience persistent abdominal discomfort like stomach cramp, bloating, and stomach pain. Okay, these are persistent, means you have it every day, and a feeling that your bowel doesn't empty completely, and sometimes you feel weakness and fatigue, and unexplained weight loss. Sometimes early stage of colon cancer may be no symptom, so probably have to actually listen to your body. Yeah. Next. Okay, who are the people at risk? Older people above 50 years old, and the other one is a family history of colon cancer, and this one quite obvious, a previous history of colon polyps, because it may actually turn out to be cancerous. So we will know. So another thing is a history of ulcerative colitis. These are the ulcer in the lining of colon, and Crohn's disease. And Crohn's disease is actually referring to the so-called ABD. It's a bowel disease. Okay. Next is a smoker. If you're a smoker, probably at a higher risk. Actually, why smoker is at a higher risk? Normally, we associate smoking, okay, with lung, okay, more on the lung. Okay, the reason is that the cigarette itself, the smoke itself, is actually carcinogen agent, which is a cancer-causing agent. So this, when you actually breathe in to our body organ, okay, it breathe into our body, actually they actually damage some of the DNA. They actually affect the cell development. Okay, this from the study, they found that this is one of the cause for smoker. Next will be diet, high in fat and low in fiber. Next, how can we prevent it? So of course, healthy balanced diet. Okay, limit intake of fats and intake more fiber, fruits and vegetable. So by taking more fiber, actually to help the actually bowel movement to push up, okay, much easier, and avoid processed food and red meat. Regular exercise, at least 30 minutes per session. Okay, why regular exercise does help? Because regular exercise actually provide antioxidant, okay, and your body will behave much better for cell repair. And stop smoking if you are a smoker. And the next one is to manage your stress. Stress itself, everyone have, but different people have different stress levels. So we have to learn how to manage your stress. And stress will be hard to measure. So probably only you yourself will know when to actually manage it. Next, we'll go for health screening. Next. Okay, how we actually diagnose it? There are two type of tests. First one is actually fecal immunochemical test. It's actually send the stool to the lab test, and they will actually check for blood in your stool. Blood in your stool, actually, when you have those polyps, okay, actually when your stool become hard or rub against that with your polyps, you actually had some bleeding from there. That's how they detect. But for this blood in the stool, it's not so accurate, 100%. Okay, so normally when you have blood in the stool, doctor will actually send you for another test, which is called colonoscopy. So they use a flexible tube with a video camera to view the entire colon and the rectum area. So once they found any polyps, they will actually, during this procedure, when they find any polyps, they will actually cut away. Yeah, next. Treatment. There are 4 treatment types, okay, for this cancer colon. First is a surgery, and they will cut the move, or the surgery is to remove the tumor if the cancer tumor has not spread. But the drawback is a surgery risk. Next is a chemotherapy. They use medicine or drug to actually treat the cancer. So they will kill the cancer cell directly to actually prevent them from spread. The drawback is that normal cells were affected also. So during chemo, when chemotherapy, it's quite common that bone marrow suppression, intestinal wall injury, all these will happen as a side effect. Next is radiotherapy. They use high energy particle to destroy or damage cancer cell. So this will be actually targeted at tumor that is more localized. The drawback is fatigue, skin change, and appetite loss. The last one will be targeted therapy. So this one is they use a very special targeted drug to actually more precisely identify and attack the cancer cell. The good thing is that they have little damage to a normal cell, but this may come with a cost. Some drugs are quite expensive and also carry some side effect for some of the patients. Next. Okay, a good number of health food featuring the ability in regulating our physical constitution and immunity can actually lay a foundation to control the growth of cancer cells. So these are food we actually can consider to consume. Example, Lingzhi and Ganoderma has been regarded as a top grade health food in enhancing all this health. Next. So what is Ganoderma or Lingzhi? In fact, this Ganoderma and Lingzhi is a type of mushroom, okay, that has healing property. So it's a 2,000 years of history, okay, and 50 years of modern scientific research. So consistent and long-term consumption of Lingzhi help to regulate and rejuvenate your body function, hence slow down the speed of aging and prolong one's life and improve the quality of life. This is according to the so-called the oldest medical book back in 2000 year in China. They call 神农本草经 and 本草纲目. So these are two historical medical book in China. More than 1,000 search result for keyword. If you go for Google search, you can actually find this Ganoderma, Lingzhi, and reishi, and diseases from the PubMed, which is U.S. National Library of Medicine, National Institute of Health. It's a repository for all the research paper. Yeah, next. What are the function and benefit? Okay, they Ganoderma on cancer treatment, supplement treatment, they actually do regulate immune system, fortify immune defense for cancer prevention. As we know that immune system is very important. It's the first line of defense. Okay, look at this current COVID. Okay, before vaccine come, we don't have any drugs to actually solve this problem. The only way to solve this by your own immune system. So immune system also important that when you have infection, they will reduce the chance of infection. So during treatment. Next is they have another benefit is improve blood circulation. So in TCM term, it's a smooth flow of blood and qi can actually prevent the formation of lung. This is in TCM perspective. Enhance liver function. So detoxification. So liver function, as we know, during this cancer treatment, all drugs come into our body. So you have to actually pass through liver to actually detox all the drugs. So your liver function might be strong at this time. So it helps to prevent, so for Lingzhi, it actually help to prevent potential side effect of drug to liver, elevated liver enzyme. And last benefit would be remove free radical and antioxidation. free radical cause damage to the DNA, which actually affect your cell development, okay, related to cancer. So what are the components of a Ganoderma that help in all these benefit is terpenoid and micromolecular polysaccharide. These are the extract, okay, extraction from the Ganoderma itself. Next. So Ganoderma assists in cancer treatment in two approaches. Okay, the first approach, before I come to this approach, in cancer treatment, the objective is to, okay, remove the tumor. Another one is to stop the tumor from spreading, the cancer tumor from spreading. So when you are able to stop the cancer tumor from spreading, you actually increase the patient's survival rate. So Lingzhi at this point is very good. They prevent the cancer cell. They are able to prevent the cancer cell from metastasis, means spread by way of induced apoptosis, and to kill cancer cell directly. Okay. Next is that complement treatment to chemotherapy and radiotherapy by antioxidation and stimulating mechanisms such as bone marrow hematopoietic. So this is the so-called produce the red blood cell mechanism. So during chemo, because of the side effect, most of patients will have this side effect as a bone marrow suppression. Okay, so Lingzhi at this point is very good in stimulating the mechanism to produce red blood cell. And another benefit would be liver protection. Just now we say that we have to actually detoxify. So liver must be protected in order to function well at this point in time. Next is to reduce the side effect of chemotherapy and radiotherapy. There are there are many evidence, okay, on the research of Lingzhi on cancer treatment. Just now I mentioned about the PubMed, which is a US library repository for all these research paper. So as of 30th of July 2020, there are total about 900 publication, okay, study on this Ganoderma and cancer. Next. So here are the evidence-based research and technical paper, okay, and all these show that terpenoid can actually inhibit new vessel formation in a direct manner, but for polysaccharide has the effect of indirect manner. So first, for polysaccharide, they will actually strengthen the immune molecule, and later let the immune system take care of the inhibit of new vessel for cancer cell. So this terpenoid and polysaccharide are these two extracts from the Ganoderma extraction. So another thing to take note is that the study found that high dose have prominent effect on tumor tissue inhibition. Yeah. Next. So here is also the evidence-based research and clinical trial. So this one is a supplement treatment to chemotherapy and radiotherapy. So this one is on the actual patient itself. Okay. Look at the second row. They actually have done back in 2003 from New Zealand. They actually used polysaccharide, okay, on terminal colon cancer patient in stage 4, combination of stage 4 and stage 3. And the result is quite well. 41 patients remain alive after 12 weeks of this Ganoderma intake, and they monitor that their cell activity, their natural killer cell of this patient increase, and also observe that their side effect of this treatment have been reduced. So Ganoderma can modulate the patient's overall immune system, enhance their body anti-cancer ability, and at the same time raise their tolerance to chemotherapy and radiotherapy. So over here, they actually use the purified polysaccharide dose of 5.4 grams. We just now mentioned about the study on those of 47 patients. They use 5.4 grams of purely purified polysaccharide. Okay, so this come to about equivalent to about 96 capsule or 2 bottles of YK1. Okay, but they actually use it for 3 months to see this result. So these are the clinical trial. Next. Okay, now we look at the Ganoderma research on colon cancer. So the researcher is trying to find out how Ganoderma can inhibit the growth of colon cancer cell. It's done by the one of the professor in Kangning College, Taiwan. So in this research study, they did 2 type of. Wait, next they will do another study. So since they know all this factor will affect, they will actually do an in vivo study, meaning that they actually now try to get this terpenoid, okay, injected into a living organism to see how this cancer cell behave. So they did this on the immunity deficiency mice that were injected with the colon cancer. They want to see with that for 421 days what is the reaction from this cancer cell. Why they chose immunity deficiency? As I mentioned just now, terpenoid is the direct method. They want to see whether this terpenoid can the cancer cell whether react this terpenoid directly, okay, without the immune system help. Okay, because I mentioned there are 2 components. Polysaccharide is an indirect method. Polysaccharide means that they will train the immune system to actually let the immune system handle the cancer cell. Okay, but now they want to prove that with terpenoid, it's true that it's a terpenoid effect on this cancer cell. So they actually found that yes, after fed the mouse with for 21 days with this terpenoid, they found that really that the cancer cell is not growing and inhibit effect is there. Then they realized they do further study, take the tissue out and measure and do some check and measurement. They found that in fact the effect is actually they stop the EGF signal path. So this EGF signal path that stop the VEGF is a growth factor, and the other one is a growth factor receptor. So this path is a signal path that actually sent out from the cancer cell. So cancer cell, when you start to, before they grow into tumor, they want to grow into tumor, that then they have to actually, in order to survive, they have to build new blood vessel. So in order to build new blood vessel, they will actually send out a signal. So this is a signal path that actually send it out. When you have all this send out, the VEGF factor will actually be excited and they will produce. So this blood vessel will actually form. So when you form, once you form, they become bigger and bigger and it multiply. So once it multiply, it actually, in order to survive, they actually hijack all the food, all the nutrient from your body in order to survive. So this is how you go on the process. And the worst thing is that they don't follow the rule. They keep multiplying and they won't die. Our normal cell go through the apoptosis. They will actually die. Okay, when it comes to a certain time, there is a life cycle. But for this bad guy, they don't actually die off. They will continue to grow. Okay, so they found that yeah, it's true that you can inhibit the growth of colon cancer by applying terpenoid. Next, they want to look at is the mice organ had any negative reaction. Since you put a high dose, they want to see whether it affect any other organs. So they found nothing. So it means that the application is quite safe. So all in all, the summary is conclude that Ganoderma lucidum extract is effective in inhibit the growth of colon cancer cell, and it is effective only when the Ganoderma is in high dose for a longer time frame. Next. Okay, now we touch on the Shuang product. So Shuang itself is in Taiwan they call double cream. Okay, in the Southeast Asia, we call Shuang. So this company have been in the business for more than 30 years in Ganoderma research and development. They have their own farming and production and own their own distribution channel. So this Ganoderma product with rich terpenoid and micromolecule polysaccharide content. So these are the few products currently we have now. Yeah, and it's scientifically certified with government endorsement. We have HSA from Singapore, TQF, and Allah certificate, ISO 9000 and all this certification. Next. Okay, now we come to the recommended dosage. So for cancer prevention, okay, it's a 12 capsule of YK1 daily. Okay, and for complement, when you're doing treatment, you want to do complement to your chemotherapy treatment. We term it as mega dose. So 60 capsule for YK1 or equivalent to 10K of YK2, because they actually use the terpenoid content to actually mix and match. So for daily, consume 3 times daily or every 2 hourly. So for stage 1 cancer, you start with 30 capsule of YK1 or 5 capsule of YK2 daily. And for stage 4, more than 20 capsule of YK1. As we know that just now, high dosage, okay, will have a better effect on the tumor to inhibit the tumor from growing. As we know that stage 4, when it comes to stage 4, is that the original cancer has already spread to distant organ. That's why we need, and at this point of time, it actually spread. When the spread is actually quite far, and when they grow, it's exponential growth. Okay, so we need this high dose. So for long-term cancer prevention, after remission, so after remission means after you discharge, when you go for chemo and after the treatment, everything settled, doctor certified that, okay, you are okay. So at that point start, okay, to continue with the Lingzhi is that first year, not less than 30 capsule of YK1 daily. Second and third year is 20 capsule YK1. And fourth to fifth year, 15 daily for YK1. And above 5 years, okay, that's good news. Okay, above 5 years, you can actually reduce to 12 capsule for maintenance. And take note that all this dosage is actually based on many years of experience of many testimonial, the actual case, okay, the dosage that they come out this recommended guideline, so-called guideline. You can take more, no problem, but only thing is that this is just a guideline, okay? Yeah. Okay. Next. Next, we touch on testimonial. Okay, this testimonial, Madam Han from Singapore, back in 2011, at the age of 63. So she got no symptom except discomfort in the stomach and occasionally bloated stomach and minor pain in stomach. But one day found blood in the stool. So went to see doctor and diagnosed second stage colon cancer at the Singapore Khoo Park Hospital. It's a neighborhood hospital, and it was confirmed by various tests, colonoscopy and CT scan. Okay, and advised to have surgery to remove the cancerous tumor and chemo, and followed by chemotherapy. So 2 weeks before the surgery, started with Lingzhi. She took 20 capsules of Lingzhi and 40 capsules of pollen. Okay, 3 times a day. So on the 5th day, she got vertigo reaction. So on the very same day, she passed out a large amount of stool and was very smelly. And this is the first time he saw so smelly, so dark, and so large amount. The husband also complained. So on the 6th day, okay, they added 2 higher concentration of Lingzhi daily and continue with existing Lingzhi and pollen dosage. So overall, she had been taking Lingzhi and pollen for 12 days and only stopped the Lingzhi 1 day before the surgery. So after surgery, the husband went and asked, how is the tumor? How is the cancer? Everything. Doctor cannot explain why the tumor had disappeared. Okay, but the husband asked further, if no tumor, why you go for surgery? So the doctor also said he based on the colonoscopy and the CT scan and it's approved. So, but anyway, they were very happy that the tumor has gone. So chemotherapy is not needed. So they discharged the hospital after 6 days. So to recover fast, she took fiber and protein supplement. So after recovered, dosage reduced to 2 times a day, each having 6 capsules of Lingzhi with pollen. Okay. Okay, testimonial 2 is a male from Taiwan, Mr. Shuang, age 80, back in 2011, and diagnosed with stage 4 colon cancer back in 2001, which is 10 years from 2011, so at the age of 70. So in March 2001, he had diarrhea with blood and loss of appetite. So there was no symptom about abdominal pain or anything. So in July, about 4 months later, July 2001, he finally agreed to go to medical check after persuaded by the family. And after that, they diagnosed that, after diagnosed, he refused to go surgery, okay, and only willing to go for chemotherapy and radiotherapy. So a few weeks before the treatment start, family persuaded him to take Lingzhi because the family is quite worried, okay, without going for surgery, so they do not know what's the outcome. So I've been persuaded him to take Lingzhi. So he started 5 capsules of Lingzhi and bee pollen every hour for all his waking hours. What does that mean? Meaning that when he wake up 10 hours, meaning he will take 10 hours of Lingzhi. Every hour, 5 capsules, Lingzhi and pollen. Okay? So he continued until mid-August. He started the chemo and radiotherapy. 3 months later, medical review showed that cancer marker dropped. Okay, cancer marker for this colon is a CEA marker. It dropped. Okay, and quantity, the number of cancer cells also reduced. And follow-up review found that the colon condition also improved. So he continued 5 capsules of Lingzhi and bee pollen for 3 times a day. So every month follow-up review with the blood test to monitor the condition. And all in all, after 6 months, okay, doctor declared that the cancer cell had gone. So since then, he maintained with 3 capsules of Lingzhi and bee pollen for 3 times a day. So all these testimonials actually extracted out from the Ganoderma magazine, 2013, issue 61. If you are interested, if you want to know more, you can actually read through. But too bad it's in Chinese. Next. Okay, now we touch on the supplement product from Shuang, Yongqian pollen. Okay, Yongqian pollen, they have more than 16 vitamin, 16 mineral, 21 amino acid, 28 nucleic acid, and 94 enzyme and coenzyme. So all this, as you know, just now we explained about the digestive system. These are all the essential nutrients, okay, that we need for our body. The function and benefit will be regulate our nutrition imbalance, okay, fortify our immune defense, and hence absorption of Ganoderma, and increase stamina and remove fatigue. Yeah, next. And now 2 good products. Jia Hor Fiber. Okay, fiber is to promote peristaltic movement in the intestinal tract. So it actually softens the stool but help to prevent constipation. So once you can actually do that daily, it actually reduce the chance of colon and colorectal cancer. Okay, Lactoberry is actually provide a lot of good bacteria in the acidic environment in the colon area. So it actually helped to reduce the risk of colorectal cancer. So they also encourage the growth of other bacteria, beneficial bacteria discourage the proliferation of the human harmful bacteria. Next. So this is the Jia Hor soya protein. So this soya protein is a very unique group of protein, soya protein in phytoestrogen in plant, subduing growth of a tumor cell and prevent cancerous disease. And there's one, they fight against other cancer as well for this product. Next. So these are some of the so-called statistics, okay, from other country that they found that country consuming soya food have less breast cancer, okay, and also people consuming soya food have less cancer, okay, in particular colon and rectal cancer actually can cut down by 80%. This is a study, okay, in Japan, and stomach cancer it can actually reduce by 40% in China. So also helpful in the rest of other cancer. So soya food and cancer prevention is all related. Next. Okay, the conclusion is cancer is still one of the most dreaded disease, and Ganoderma Lingzhi is one of the best health food to prevent and also complement treatment on cancer. Ganoderma enhance our body immune system, which is very important for the first line defense, and use Ganoderma together with surgical removal. Okay, chemotherapy and radiotherapy is effective in improving the overall condition. So consumption of other Shuang products like bee pollen, fiber, protein, lactoberry. In fact, forgot to mention that lactoberry is a probiotic product. Okay, they have special dual protected layer that actually ensure that this probiotic component go into the intestine and colon area. And with all these supplements that actually can be considered as part of the balanced diet formula, be it treatment or normal diet. With that, I end my sharing. Thank you.